Good morning, Trinidad and Tobago. You are tuned into another virtual media conference hosted by the Ministry of Health, which will provide an update on the national COVID-19 response from a health perspective. Today with us are Dr. Avery Hinds, Technical Director of Epidemiology, and Dr. Jeanine St Bernard, County Medical Officer of Health for County Caroni. I am Candice Alcantara, Manager of Corporate Communication at the Ministry of Health, and I will moderate this morning's media conference. We begin with Dr. Hinds, who will present the clinical and the epidemiological updates.
Thank you, Ms. Alcantara. Good morning to Dr. St. Bernard. Good morning to members of the media, members of the viewing and listening public. I'm going to actually put the clinical update onto the first slide. So if we could have the first slide from the presentation, actually the second slide, we'll be able to see what we're speaking about. Second. So, as at March 19th at 4 p.m., we would have had 104,278 tests completed at both the public and private facilities. Of those tests, we would note that 7,821 would have returned as positive, and we have 7,552 total recovered patients and 140 deaths. And we extend our condolences to the members of the bereaved families. There are currently 129 total active positive cases, and those are distributed as follows. There are 6 persons in hospital. Those persons distributed as follows: 5 at the Couva Medical and Multi-Training Facility, and 1 at the Scarborough Regional Hospital at Fort King George. There are 113 persons in home self-isolation. There's 1 individual in a step-down facility, and that's at UWI Debe. And we've had 9 new positive cases confirmed in the 48-hour period from the 16th to the 18th of March. In quarantine, we currently have 421 individuals in state and state-supervised quarantine facilities. Let's go to the next slide. We're going to go directly into the review of the epidemiologic trends. Now, what we want to show here is really looking towards the right-hand end of this graph, the end where we have the orange bars. And if we look at that dotted black line, which we call our rolling 7-day average, we're going to see that we've started to see an increasing trend in that 7-day average. That dotted line is going up a bit instead of the downward trend that we were looking at before. So whereas we would have had a rolling average that would have been about 3 or so persons per day, over the last couple of weeks we have seen where that average has slowly risen to around 8. And that is largely driven by some cluster activity, which we're going to take a little time to speak about and to go into in a little more detail. So let me have the next slide. Now, one of the things we wanted to show here is just the level of potential, and in this case, actual spread that you can see from any one individual to several primary and secondary contacts. This is a linkage diagram, and this linkage diagram is color-coded as follows. The red circles are the index or initial cases, the first cases that we would identify in a chain. The purple circles are the cases to whom who were exposed to that red case, rather, or the primary contacts of that initial case. And these are the ones in a particular instance over the last week who have turned positive. So they're not just contacts. Now they are cases that have arisen as a result of their contact. The light blue or aqua or teal, I'm not good with colors, so light blue. The light blue circles are the persons who would have been exposed to those primary contacts, those are secondary contacts, who have again become positive. So if we start at the top left of this linkage diagram, we will see that one individual, the red, has had 5 purple circles associated with them. So that's 5 primary contacts that then converted to actual positive cases. And one of those primary contacts has now 5 blue circles associated with them, meaning 5 secondary contacts that have also been confirmed positive during their follow-up in quarantine. Now, this top left red dot, we're going to actually expand on that one in a little bit. So there's a whole other slide on that one. But let's look at the other numbers. We're looking at the scale at which this illness, this virus can spread itself. So the second red dot has 4 of those purple circles, so that one person contributed to at least 4 known positives, and one of those 4 known positives then had 2 of its own cases as positive thereafter, 2 of its own contacts. If we go to the right again, the next 2 red dots show 3 confirmed positives each for the index cases that those red dots represent. If we go down to the bottom, we see a nice little chain of red to purple to blue. So 1 confirmed primary contact and 1 confirmed secondary contact. And then the next index cases that we see 2 each. So we are seeing between 2 and 5 positive cases being confirmed after contact with these index cases. And that just goes to show the speed at which, the rate at which this illness can then blossom into a large group of confirmed positives if we aren't careful, if we aren't following the guidelines, if we aren't paying attention to our feelings of not feeling so well or general well-being, if we aren't actually taking the time to take note of whether we feel even mildly ill and following up on that. And this is a case in which we have actually located and identified positives who have been in contact with an index case. In the cases where an index case or an ill person isn't actually ill enough or doesn't have any symptoms and it doesn't come to the health system and isn't diagnosed, you can see the potential for several people to become ill just because there's an ill individual, an infected individual in the population. Now let's go to the next slide. This next slide actually focuses a little more on the top left red circle from the previous slide. This individual in this particular case actually attended a religious ceremony, a religious service, and because of the apparent close interaction between individuals in that service, you will note that there are actually several primary contacts that have become cases. Let's count them. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. And of those, 1 then went on to have another 5 individuals with the secondary contacts also turn up as positive. Now, one of the important things that we spoke about before, and I'm going to highlight here briefly, is the fact that a lot of the secondary contacts, meaning the contacts of the first row, the first layer of people in touch with an index case, a lot of those secondary contacts tend to be household contacts. Now, we spoke in some detail a couple Saturdays ago about the guidelines for reducing the risk of transmission within the household. We did mention at that point that those guidelines are hosted on the Ministry of Health's website, and we do want to emphasize the importance of being aware of these guidelines, aware of the steps that can be taken to reduce your risk within your own household, because many of those clusters of 5 or so cases arising from contact were generally household contacts, with the exception of this group of 15. It looks a bit like a Ferris wheel. That was really a contact situation within a religious ceremony setting. Now, we're going to have a little more of a conversation about some of the details around the contact tracing, things that were discussed and things that we want to emphasize as important points in reducing the risk for this sort of spread. But the highlight of these 2 slides is really that a small number of cases initially can blossom quite quickly into a large group of secondary cases and of tertiary cases as the illness gets transmitted from one person to another. We've put up a pyramid on several occasions. I don't know if we have it accessible to put up again, but if we can have the pyramid up, we'll just have a conversation about it. And if not, basically, these slides demonstrate the pyramid in its own, in their own way. Let's go back one slide. Let's go back to the slide before, where we see exactly what we've been speaking about with that sort of spread. The pyramid being you start at one point and then the number of cases widens as you go from one layer to the next. This also emphasizes the importance of the measures that we take when we take preemptive action, as we say, we take in front, and we quarantine individuals who have been exposed, even before we know if they are positive or not. In so doing, what we do is we reduce the risk of these individuals setting off their own chains of similar size. So although the quarantine restrictions and activities and requirements may be considered a bit burdensome, and maybe even considered a bit excessive, we can see the need for them here. We can see where 2 layers down, you have one person ill, and then the people that were exposed to them and the people that were exposed to those people, we have significant amounts of transmission between those layers, which is why we quarantine the primary, the secondary, and the tertiary contacts. And here's the pyramid that we were speaking about, where we see one person, the person at the peak, that person in black, spreading to 2, those 2 people spreading to 3 each, because the number isn't fixed. The number isn't a specific number where the virus says, okay, I've gotten to 2 people, now I'll stop. We saw in this case real life data where we got 5 people coming off of 2 sets of cases, 2 layers down, and this just so it demonstrates the risk of having very large numbers arise very quickly in a very short space of time in the absence of these public health measures. So this pyramid would actually be a lot wider and contain a lot more people if we use the numbers of spread from one generation to another that we have seen just in the last week. So this is what we want to emphasize the importance of, and we're going to actually go over to Dr. St. Bernard to have a little more of a discussion on some of the details of that contact tracing activity that would have been conducted. But the key point at this point is that we do need to maintain all of our public health measures in order to prevent even 1 or 2 small numbers of cases, as we're seeing popping up, from becoming very large numbers in a very short space of time. I'm going to turn you over to Dr. St. Bernard.
Thank you very much, Dr. Hinds, for that very, very important reminder in visual terms that we all need to follow all of the new normal guidelines all of the time. And I know we have heard these before, but I think it is important to keep reminding each other of the steps that we should take to protect each other. And I'm talking here, of course, about wearing a mask over your nose and mouth. And it's important over your nose, mouth, very important to wear the mask in that way. Keep your distance from others. 6 feet of distance, please. That's about 2 arms lengths of 2 average adults. Some people have longer arms than others. Stay home if you are ill. It is so important. Please remember the symptoms of COVID-19. Sometimes they're very mild. Sometimes you have no symptoms. But if you are ill, please stay at home. Wash your hands often with soap and water. That's the best way. But if you don't have soap and water, please use hand sanitizer. Cough into a tissue or into the crook of your elbow and throw the tissue away after you have sneezed. And it's a good idea to follow that up with hand sanitizer, or even better, washing your hands. Avoid touching your face. We're trying to prevent the introduction of the virus into your body. And then, of course, clean and sanitize surfaces. So, tabletops, doorknobs, but cell phones. These days, our children are using tablets quite a lot so that they can get their education in. Please remember all of these new normal guidelines. And we go now to another, what I'd call a reality check, a realistic example of some of the developments of COVID-19 that are happening in County Caroni. And Dr. St. Bernard is here, and you would have heard us speaking about County Caroni before, and she's here to provide us with an update. We go to Dr. St. Bernard.
Hello, good morning. Good morning, Dr. Hinds. Good morning, Ms. Alcantara. Good morning to the media. Good morning to the viewing and listening public. And I want to make a special shout out, good morning, to our students who are about to sit examinations in a couple months. So here I am invited yet one more time to talk about County Caroni and what we are experiencing when it comes to the number of cases. At this point, I would have to describe what I am seeing in County Caroni as a bit of a surge, and I would like to speak to some of the issues surrounding why these numbers seem to be going up. So the last time I was here, I gave the number of cases for County Caroni for the month of February. I gave the number at the start of February as 44, and the number at the end as 25. We were going in the right direction. And when I actually came on air, we only had one case within the last 3 days, meaning the first 3 days of March, so we were up to 26. Today, the 20th of March, 2021, there are 60 cases of COVID-19 in County Caroni. 60 meaning 60. And the number of cases from the start of March had doubled to 52 on the 16th of March. So within 15 days, we had doubled our number of COVID-19 cases. So, for the month of March, so far, we have actually had 55 new cases when we add each day's tally for new cases coming to County Caroni. And of those, we have had more than 900 contacts to follow up. Primary, secondary, and tertiary contacts came up to more than 900 in total. And these persons we are following up via our usual telephone calls. Given the severity of the situation in Caroni, as I observed the numbers continuing to rise, we needed to implement some measures to try to contain the spread. So what we are doing currently is we are swabbing all primary contacts of a case, whether these are household or non-household primary contacts, whether they are symptomatic or asymptomatic. So what that means is someone who worked with you and you are a COVID-19 case that's confirmed and that person was a primary contact, we are now inviting you to come and be swabbed, or we are doing the usual home swabbing where we visit, and we are quarantining all primary, secondary, and tertiary contacts. This may sound severe, as Dr. Hinds mentioned earlier, but it is something that within County Caroni specifically, we thought it was necessary to do in as much as the numbers were continuing to rise, and they were rising rapidly. Therefore, whenever you hear me say, because I'm going to get into the details, right, as I continue to speak, whenever you hear me say primary, secondary, or tertiary contacts being generated, understand that these persons are being placed in quarantine. So I'm going to give you now a story of a church, a bar, and a police station and army camp. Recall the last time I was here, I said it only takes one person. So let's see what happened as a result of the one person. So what has happened is, if we start with the story of the church or the place of worship, right? What happened is someone was not well. They presented to an accident and emergency department where they were swabbed. And they then proceeded to go to their place of worship, where they then spent some time with other members of that church or that place of worship. I have specifically left the gender, the age, and the location out of my story for the sake of preserving patient privacy. I will say, though, that the church was not actually located in County Caroni. So again, it shows the linkages and how we are all connected. County Caroni is not in a dome. So what happens in County Caroni will affect other counties and affect the country. This person that was part of an ongoing church activity led to the following counties then becoming involved. County Caroni itself, we had 4 contacts that were COVID positive. County St. George East, we found 2 contacts of that case that were COVID positive. And the County St. George West, we had 3 contacts that were COVID positive. And remember the wheel that Dr. Hinds just showed us with the number of cases being generated from that top red dot. So, in actual numbers, the case generated within our county, 23 primary contacts, 46 secondary contacts, and 41 tertiary contacts. The case generated, as Dr. Hinds told us, 15 more COVID positive cases. 12 arose from the swabbing of the primary contacts, 1 from the swabbing of the secondary contacts, and we had to transfer 22 primary contacts to other counties, and 29 of our 41 tertiary contacts then had to be followed up within other counties. So we see that we have some concerns with regard to not following the guidelines and the extent of spread as a result of the place of worship. Now I will speak briefly about bars and some situations that have arisen, and this is as a result of the contact tracing that occurs when we speak to the case to ask them who they were in contact with and where they may have presented or where they may have gone. So in speaking to one of the COVID positive persons, they were associated with a bar, and this generated the following cases and contacts. 4 primary contacts, of whom they were swabbed and they were all COVID positive. 5 secondary contacts, of whom 2 were COVID positive, and 1 tertiary contact that was tested and they were found to be negative. In terms of households, which we would have seen with the beautiful colors that Dr. Hinds showed us, those were 2 households, and if you looked at it, you would notice in one household, all 4 persons tested positive, and in another household, all 3 persons tested positive. So we see again how it only takes one person to then spread to another and spread to another. We actually had 2 cases that when we investigated and asked where they'd been, they actually admitted to bar hopping. I don't know if you all know the tradition. Some of us know the tradition of you don't just go to one bar, when you park up outside and you hang out with people, but then you proceed to go to another bar and another bar. And this is a practice, of course, that I would want to strongly discourage, as the potential for exposure to COVID-19 increases, and it increases exponentially, meaning the curve goes up and it goes up very quickly. So with regard to our persons who are there to protect and to serve, we have had cases generated, and these cases, some of the cases actually generated 41 primary contacts, 154 secondary contacts, and 51 tertiary contacts. And some of these contacts would not just be household persons, but would be officers themselves. And these officers, of course, in having to quarantine these persons, we have now actively reduced our active police population because these officers will now have to be home in quarantine. Some of the original cases arising from the station, they generated 6 more COVID positive cases, of which 3 were primary contacts and 3 were secondary contacts. Each contact then becomes a COVID case and, of course, can generate a whole new branch where we have to contact, swab, and quarantine. So something about what we always speak about with regard to mask wearing and so on. When persons with COVID-19 do the following, they produce respiratory droplets or fluid from the lungs. When you cough, when you sneeze, but another one that we need to emphasize now is when you sing and you're not wearing a mask, and when you talk, and sometimes we observe people pulling the mask down to the chin because people aren't hearing them because the speech is muffled, right? And of course, when you breathe, droplets can be spread and therefore COVID can be spread. Infections, of course, will and spread then occurs because of the mask not being worn properly and doing things like singing if you're in a place of worship and you are not adequately distanced, and of course if you're not wearing your mask. Not wearing masks while drinking, well, obviously if you're eating or drinking, you are not able to wear your mask, and so what we're depending on would be the social distancing. Not watching your distance. Persons may not be necessarily gathering inside of the bars, and I will speak to a meeting I would have had, but they have been observed a growing trend for people to gather on the streets outside of bars, right? This is a very disturbing trend given the number of cases and contacts that were given earlier that arose directly as a result of people being around or in a bar. A mask is not a substitute for social distancing, so it's not that if I have on the mask I can gather and be a lot closer to people. In my attempt to try to stem the tide, the wave that seems to be happening in County Caroni, I actually met with the president of the Barkeepers and Operators Association this week, for us to see what we can do, what can we do to work together, to collaborate, to help reduce the number of cases. And of course, the intent of the meeting was to encourage greater cooperation between the barkeepers and operators so persons would not gather within the bars or be allowed service without compliance to the COVID-19 protocols. And of course, we also don't want these establishments being brought into disrepute. The takeaway message from the meeting is that the association is actually completely on board and they are in complete support of the continued adherence to the COVID-19 protocols. So I came away from that meeting very hopeful. I truly appreciated the level of keen interest and support shown at this meeting. And of course, barkeepers do not benefit from bars having to be closed to sanitize or close because all of the workers are either infected with COVID-19 or at home because they're in quarantine. It is important that social distancing is maintained outside of the bars. Barkeepers may not have jurisdiction over the pavement across the road from the bars, but most certainly they can discourage persons from gathering immediately outside of the bar or in the precinct of the bar. And of course, it's been very discouraging to my surveillance team who are now working around the clock again, Monday to Monday, when they personally witness massive gatherings immediately outside of bars with persons not wearing their masks and knowing that they have had to call not one person to tell them that they were infected with the COVID-19 virus, but 6 more persons having to be contacted and told that they are actually infected as a result of the association with the bar. And of course, arising from the one person associated with the bar, people testing positive would have been the 4 primary contacts, as we saw in the graph, 2 secondary contacts. And of course, the implication is that you should welcome swabbing. So if I could just speak to that issue of persons, politely declining and saying it's okay, I don't wish to be swabbed. The disadvantage of not swabbing when you are a primary or secondary contact of a case is that we then miss the fact that you may be positive and therefore we cannot contact trace and identify persons who may have been exposed to you who then need to be quarantined so that they will not then go on to pass on the virus. We are noticing that trend of people refusing to be swabbed even though they are living with a COVID positive person. And it's not that if you decline swabbing, you will not be quarantined. You still need to be quarantined because you are exposed to someone at home who is COVID-19 positive. And now I wanted to just end on this issue of the schools and the impact on CSEC and CAPE. There is a potential impact. As I said before, based on the high numbers of cases in County Caroni at the moment, we've had to ramp up our approach to try to contain the spread. We call that ring fencing, right? And that involves the quarantining of several persons. But of course, this is affecting business continuity. And of course, it will affect school attendance if a child is a contact. We've been very diligent to pay attention to see if we've had any students having to miss school, in the Form 4 to 6 category because they're a contact of a case. And so far, we've literally only had 1 student being a contact and having to be in quarantine. Remember that the exams are starting for our students, CSEC and CAPE. They're starting in June. And of course, we don't want students to miss their final exams. These are not mock exams. We don't want them missing final exams because they are a primary contact of a case or worse, a COVID-19 case themselves. COVID-19 is still an active threat to the health and well-being of the citizens of this country. It is a threat to our students, our children who are starting exams soon. And of course, the public health measures and the COVID-19 protocols have been there for the benefit of the citizens, which include our children. Let us please, I beg you, let us please adhere to the protocols. Let us continue to work together to save lives and the future of the next generation. The surveillance team in County Caroni is continuing to work hard to save lives. But we also need you, the population, to take responsibility as well. Please, I ask you, wear your mask, wash your hands, and watch your distance. Thank you.
Thank you very much, Dr. St Bernard, and for highlighting some of what is happening in County Caroni. And Dr. St Bernard was able to give us some examples of various areas of congregation. We looked at especially the workplace, the home, the church, places where we gather to entertain. And it's very important that we follow all of the guidelines all of the time. It doesn't matter where we are, unless we're in our household bubble, we have to continue to follow all of the guidelines. And we go now to the question and answer segment. Members of the media, please indicate your name and the media house that you represent before posing questions. In the interest of time, we ask for a maximum of 2 questions per media house initially. And of course, if we have additional time, we will come back to you. We remind you, please ask both questions at the same time, and we will try to answer as comprehensively as we can. And we begin the Q&A this morning with questions from 98.1.
Good morning again to you, Ms. Candice Alcantara, and of course Dr. Hinds and Dr. St Bernard. I have 2 questions which any of the members of the panel can answer. Maybe Dr. Hinds might be the first person to probably respond. The WHO's, Stephen Cummings, 98.1 FM, the WHO's Advisory Committee on Vaccine Safety met to review the data on blood clots and low platelets impact on the Oxford AstraZeneca vaccine use in using looking at how the vaccine has been responding. But there are skeptics still, out there, and maybe asking in regard to our small population here in Trinidad and Tobago, is the risk still, worth taking? There continues to be, as I said, also that the view that we should be very cautious. And the second question is, and maybe Dr. Hinds can probably respond to this. Do you believe that we have, the capacity, Dr. Hinds, to produce our own vaccines here in Trinidad and Tobago? When we look at our capacity, maybe technical knowledge in terms of knowledge transfer, is that a possibility as we talk about COVID-19 vaccines and treating with the threat that we have? Thank you.
Okay, thank you for those 2 questions, Mr. Cummings. The first one I'm very happy that you raised, because we have seen where we produce the evidence, we put information into the public domain, but yet skepticism remains. What the WHO found on following up on the cases that would have presented with blood clot events, and it was even mentioned in the initial instance while they were analyzing the data. It had approximately 17 million vaccines distributed at the point in time when they raised this particular flag. And one of the things we need to point out is that once you're vaccinated, then you are in a group that is followed up very closely for any kind of event, any sort of health event that occurs subsequent to your vaccination. Now, there's a difference between subsequent to and as a result of your vaccination. So this large group of people, 17 million people, being monitored closely for anything that may occur thereafter, then generated 35 or so, I think 35 or 37 individuals who had some sort of thrombotic event, thrombotic being clotting. Now, thrombotic events, clots, occur even without vaccination, which is an important thing to emphasize. People have clots for various reasons all the time. When I say all the time, throughout the population, in the absence of this particular vaccine, this is an event that occurs with a certain degree of frequency. And the 37 or 35 cases that would have arisen out of 17 million is actually a lower rate of occurrence of these clotting events than would normally happen in the general population with no vaccine. So what we're seeing basically is, yes, we're following people up, and people have health events as a matter of course throughout their lifespan. The rate at which these health events occur in the vaccinated group as opposed to in people who are not vaccinated is what they would compare to see if the vaccine is associated with a higher rate of occurrence. In this case, it most certainly was not. There was no higher rate of occurrence. The people who had these particular events would likely have had those particular events regardless. But the issue of skepticism arises because of the way in which the information is treated, the way in which the information is spread. And we really want to make an appeal to the general public that when they're looking at these reports of health events and they see especially the more sensational coverage of particular outcomes, that they do a little digging. Maybe go back to the actual health websites themselves, the WHO website, the European Union CDC website, and look for the actual summaries that they would provide on the scientific findings. So the clotting events that happened were not determined to be as a result of the vaccine. There's no rational or biological sort of pathway that would generally lead to increased clotting after the vaccination in the first place. And then the events did not occur with any higher frequency than they would have occurred in a population that wasn't vaccinated. So these things are the details that get lost when we sort of push headlines. People got clots. There was a similar sort of setting in the earlier on in the vaccine campaign in one of the Scandinavian countries, might have been Norway, where they vaccinated a more elderly population, and then they found that they had a few people thereafter who passed on. But the rate of death, the rate of people passing on in that elderly population was the normal rate. This was not changed by the vaccination. This was not increased in any way by the vaccination. And they eventually determined that, okay, this is normal. This is the normal rate of mortality for people in that age group. Wasn't affected, but you still have that running narrative in the background that they heard some people died, even after the science has explained that this isn't something that was increased. So we do want to encourage individuals to seek well-researched and verified and scientific explanations and data in detail on these events. Now, the second question with respect to production of vaccines. Vaccine production is a massive and massively expensive undertaking, and it is generally done on a commercial basis, meaning that you have to be able to make the relevant income from the expenditure that you have generated in order to make that production worthwhile. And the size of the population that we'd be dealing with either in Trinidad or even in the Caribbean would not really make it an economically viable proposition to say we'd want to start doing something like that here, even if all the technical expertise and all the resources were available. This is why we look at the global vaccine producers and we seek to get our source of vaccines from those who are already generating large numbers to support large numbers of countries. So it's not really a proposition that would be under immediate consideration at this point for Trinidad and Tobago. So thank you for the questions.
Thank you very much, Dr. Hinds. And we go now to AZP News, please.
Hi, good morning to Candice, good morning to the doctors. Priya Bihari, azpnews.com. My questions are for Dr. St Bernard. Dr. St Bernard, I know County Caroni is relatively a large county. Can you give us an idea how large it is and where are these clusters, where are these new cases? And the second question, the primary, secondary, and tertiary contacts whom are all in quarantine. I take it that this is at home, but is there any thoughts being given maybe to put them into state quarantine? Because when someone is at home, they tend to be maybe a bit lax and may not properly follow the COVID-19 protocols. Thank you.
Thank you, Mr. Bihari, for your question. With regard to the locations, County Caroni, as you rightly said, is a large county, and we have had many of the cases falling in the southern part of the Caroni district. We actually have two RHAs managing Caroni, North Central RHA, as well as the Southwest RHA, and most of the cases we've been getting have been arising in the southern part. With regard to locations, I mean, we have Claxton Bay, we have Freeport. I mean, we have several areas within County Caroni where we are seeing the clusters. The second question you asked, with regard to quarantining the cases in a step-down facility. So the thing about the spread of the COVID-19, sometimes what may happen is before the person who is COVID positive has swabbed and knows that they are positive, there may have been, of course, normal exposure within the household because people within a household would not be wearing masks. It's the point at which the person knows that they're positive. It's the point at which they would then be required to wear masks. And of course, if someone is directly caring for them, that person also would be required to wear masks. I am not sure that persons, after they've been diagnosed, are being particularly lax. Some of the exposure could already have occurred before they even swabbed, and therefore by the time the primary contacts within the household have swabbed, they are then found to be positive. I don't know if there is need at this point to quarantine persons within a step-down facility. I think we've been doing quite well, except for these clusters where we've seen the spread to the family members. And as I said, I am not sure that the spread is occurring after they have found out that they are positive. So I wouldn't necessarily promote the need for quarantining in a facility in a step-down facility for the positive cases.
Thank you very much. And we go now to Newsday, please.
Good morning, Jeanine. This is from Newsday. The first is for Dr. St Bernard. You were talking about people declining to be swabbed. What kind of numbers are you seeing, and what are the reasons? What reasons are they giving for not wanting to have that verified? And secondly, Dr. Hinds, a general question about vaccination. Do you think Trinidad and Tobago may follow England when it comes to administering the vaccines and maybe administering the first one as widely as possible, even before the second set comes in?
Thank you very much, Dr. St. Bernard.
Thank you, Ms. D'Souza, for your question. It is such a good question that you've asked because we also are trying to understand why persons decline swabbing. People generally don't give very clear reasons as to why they do not wish to be swabbed. Some people, though, are very vehement. They do not want to be swabbed. They are not going to be swabbed. And this is after people have arranged and had transport, doctors, all PPE on. And when we arrive at the house, people then say, nope, I'm not going to be swabbed today. So I am not sure if it's they don't enjoy or don't want to experience the swabbing itself, or if it is they don't want to know, but people have not been forthright in saying, this is the reason that I am refusing swabbing. In terms of the numbers, though, we've had a lot of cooperation when it comes to persons being swabbed as contacts. We've only had a few households declining. So I wouldn't say at this point it is a major concern, but it's just something that we just want to flag so that people don't continue in the practice.
Okay, and thank you for the second question. At this point in time, the current plan will remain in place, which is we vaccinate in such a manner that we utilize the available stock, the stock in hand, the guaranteed stock, to cover a given size of population for both doses. And that really then optimizes the coverage and the public health effect of having vaccinated people at all. So while, yes, wider coverage will eventually be accomplished as more vaccines come in, we do still stick to the public health approach of ensuring that whoever we begin to vaccinate, we can complete vaccination for. And in targeting the higher risk and the higher exposure individuals, we believe that having those people completely vaccinated is going to have a beneficial public health impact in terms of reducing the risk of transmission and reducing the risk of severe disease and adverse outcomes. So the strategy at this point will still remain as it has been described.
Thank you very much. We go now to TTT, please.
Good morning, Terry Ann Brown from TTT. My questions are we seeing what level are we seeing variant strains of the vaccine in Trinidad and Tobago? How many people are we having much of that? And two, persons who have lingering effects of the virus. Past the 14 days, they have symptoms of respiratory and other lingering effects. What level are we seeing that?
Okay, thank you for those questions. Okay, let me clarify now. And you asked about variant strains of the vaccine. I'm assuming you actually meant variant strains of the virus. Now, let's be very clear. The variants of concern, those variants that have been identified in other populations, in Europe, in Brazil, that have been identified as being a public health threat, a public health concern. We have not identified any of those in our local population. We have identified a couple of those in people who were either repatriating or being tested as part of their immigration processing, and those individuals were quarantined, and they were ensured that they either didn't enter the population at all, or that they only entered after they had been cleared of infection. So we have not identified variants of concern, those public health variants of concern that you've been hearing about in the news. We haven't identified any of those in our local population. What we would have seen, though, as Professor Carrington may have mentioned, is that we saw some mutations, not mutations that generate variants of concern, but as we're looking at the genetics of the virus in circulation, you would note that all viruses mutate slightly in passing from one person to another. There's slight variations, and Professor Carrington would have mentioned that they've noted about 7 to 9 of those sorts of variations that aren't of any public health concern, but they are of academic interest, and that's why they were mentioned. But again, to emphasize that we did not have variants of concern in the population. That is, those variants that would have been termed as the UK variant or the Brazil variant or the South African variant that have been identified as causing either differences in how fast the virus can be transmitted, or how well it may respond to the vaccine, or how ill it may make you as an individual. That's what makes a variant one of concern. And we haven't had any of those, and our immigration practices, the practices that determine the repatriation, the quarantine of individuals, the screening of everybody before they come into country, those mechanisms have been helping to keep our population safe from the importation of those variants. Now, the second question, in terms of levels of lingering effects, we don't have an exact estimate on the levels in terms of a percentage, but we do know that we have seen quite a few individuals who have come back to their doctors with the longer duration of symptoms than average. So the average duration of the symptoms, sometimes the symptoms go away quite quickly, so within a week or so you're fine. Sometimes it may last 2 weeks, but then there's some people who a month later still have lingering fatigue or cough or other symptoms, and that really speaks to that the occurrence of what they call the possibility of long COVID, and we will address that again in detail. We've done it before, but we will address that again in detail in subsequent press conferences, and we'll probably try to get a closer estimate of the proportions of people that we're seeing, but we don't have that proportion at this point in time.
Thank you very much, Dr. Hinds. We go now to TV6, please.
Hi, good morning. Cindy Raghuva, Tika Singh, TV6. So my two questions. Firstly, to Dr. St Bernard, this surge that you would have mentioned of numbers doubling, I know you cover the County Caroni district. Does that mean then that there isn't a surge in the other districts? And just to follow up on that, since there is that surge, will that or can that lead to more restrictions as a result? And my second question, as it relates to exams coming up for CSEC and CAPE, if students are quarantined, does that mean they will completely be banned from writing exams? So not positive, but quarantined because they are some kind of contact, or will provisions be made for them to sit, let's say, in a separate room because, they aren't positive, they're just being quarantined? Can we clarify that for the students?
Okay, thank you for the questions. I will actually take the first one with regard to the surge and what that may mean at a national level. Now, what we're seeing is that the careful contact tracing, the careful follow-up activities that have arisen out of the cases identified in County Caroni have in fact identified several associated positive cases. Now, what that really should do to us as a population is make us all a little more vigilant. It does not necessarily mean that there are suddenly rising levels across the board, but it does mean that we can't let up in our adherence to the public health measures, in our adherence to avoiding gatherings, in the adherence to wearing the masks, all of those things that we may have been becoming a little bit lax on because it's a year in, the numbers are low, they're going down. It's just a very potent reality check that even if the numbers are low, it doesn't mean the virus is gone. And once the virus is not gone, then we have to maintain all of the behaviors that we have been advocating for and that we've generally as a population been adhering to in order to keep the numbers low. So the numbers that we're seeing changing in one county are indicative that everyone should pay attention and ensure that they're not being lax in their general behaviors, in our mask wearing within the office, in our avoiding gatherings when we are actually when we're actually feeling ill. The situation of having a test or swab done because you weren't feeling well but then still going to a gathering is a good example of what we want to encourage people not to do. If you've gone to be swabbed because you've been having symptoms, then the next place you should go is home, nowhere else. So when you go home, what you need to do is you need to isolate from your family members as well in order to protect them. So where we may be falling off on those, this reality check really shows us that we really can't, because there's a very delicate balance between what we do as a population and what the virus does as it spreads from person to person. So all the actions, the activities that we've been taking, we give this analogy, the minister has given it before. It is akin to when somebody is hypertensive and they take their medications and their blood pressures are good. Your blood pressure is good because you're taking the medications. You don't then stop taking the medications. It's like if you're driving down a hill, you have your foot on the brakes and you're going at a good speed. You don't say, great, I'm going at a good speed, let me take my foot off the brake. That's not what we want to do at this point in time. We want to keep our foot on the brake. We want to continue taking our population meds, and our population meds are those 3 W's. Wear your mask, watch your distance, wash your hands, so that we can continue to have those lower numbers. I'll turn you over to Dr. St Bernard for the second question.
Hi. So with regard to the plan for students who are not necessarily COVID positive, but are contacts, I would leave the response to that to the Chief Medical Officer or to the Minister, because we are actually currently in talks about what is the plan for the students, because we are concerned and we don't want to be caught off guard. So I would leave the answer for that to the Chief Medical Officer or the Minister for them to state what the actual policy that has been developed is, and then you can definitely ask the question again at that point.
Thank you very much, doctors. And we go to AZP News for a follow-up question, please.
Hi, good morning again, Prime Bihari, AZP News. There has been a suggestion by a Caribbean professor that we can use dogs to detect COVID-19. Is that something our ministry is looking at? Do we have resources to do that? Is that something we can look forward to, at least maybe at the airports and at mass events? Thank you.
Okay, thank you for the question. Now, I think you'd appreciate that there'll be a clear difference in sensitivity and specificity of a response between a canine and the testing that we have currently been advocating and that has been working reasonably well. So us as a population looking to switch from something that's working to something that may work with a little less sensitivity is probably not a direction that we'd want to go in at this point in time. What we currently do at the border, and the border isn't a physical place, the border is a whole transaction. What we do when people are coming in is that we actually ask them to take the very sensitive and very specific PCR test to determine whether they were positive before they embarked upon their trip. That screens out the people who would have been actively carrying COVID-19 3 days before they travel. And then we quarantine and we screen again using the sensitive PCR test to ensure that a week later people have not subsequently turned up as positive. There isn't really room at this point for a K9 unit, which will be a lot less sensitive and specific than the 98-99% sensitivity and specificity that the PCR test would have. The PCR is considered gold standard. Now, it may, of course, I mean, they've seen lots of nice videos of K9 operatives detecting lots of things, cancers, things on moles on person's legs. I've seen those videos. But there's a lot more testing, a lot more scrutiny, a lot more rigorous research that would need to be done before you could determine where in the whole group of public health measures something like that may have a place, where it may fall. It may at some point be reconsidered. They've tested dogs for COVID screening in the past, and those results haven't then said we can replace any of what we're doing right now with that K9 unit. More research would be needed. So while I'm not discarding the concept out of hand, we are saying that we won't switch from the very sensitive and specific to the still under research at this point in time, to answer your question about whether the ministry would be considering it. Certainly not at this point.
Thank you very much, everyone. We have come to the end of today's media conference. Thank you for your participation this morning. And just a reminder, a family member or a loved one who is not a part of your household bubble may bring more than love into your home. Just because someone is a good person doesn't mean that they are not COVID positive and unknowingly could spread the virus to you and your loved ones. We all must follow all of the new normal guidelines if they are to be effective. So we go again with the 3 W's. Wash your hands, watch your distance from others, and of course, wear your mask.
COVID-19 is here and has become everyone's business. It's not a respecter of age, race, gender, one's financial, educational status, or mental and physical ability. Therefore, it is our duty to prevent the spread of this virus in our communities. We all have a part to play with this pandemic. Therefore, there's so many things we can do. First of all, we can wear our mask, practice good hand hygiene, that is washing your hands and hand sanitizing, as well as maintaining the social distancing at least 6 feet apart. Added to that, you can eat well, rest well, hydrate well. Ensure that you maintain your immune boosters by taking multivitamins. We, the frontline healthcare workers, need you to help us with this fight. To those suffering with predisposed and health conditions like asthma, diabetes, hypertension, renal disease, autoimmune disease, just to name a few, take your medications as recommended by your health physician. Families, friends, I urge you to ensure that their supply is adequate. Do not let it finish. Also, take your recommended diet as per health condition. Do not cheat, for to cheat means you put your body in a difficulty to cope. To those persons living with depression, other health and mental health and emotional health conditions, self-quarantine is a difficult time. We know and understand this. I urge families and loved ones, do check up on them regularly. Send a voice note, make a phone call, extend your love, care and support to them as they do need your care and support at this time. To the youth of Trinidad and Tobago, do not think for 1 minute that you are exempted from this virus. I urge you to encourage good behavior amongst your peers. Do exercise good health practice and also ensure that you exercise the preventative health measures in this pandemic implemented for your benefit. I I must add, in support of my health colleagues, we are committed to ensuring that you receive the delivery of care that is necessary to aid a speedy recovery for those who end up with this virus. Do act responsibly. Ensure that you maintain good health practices. Protect yourself, and in so doing, protect your loved ones. For prevention is so much better than cure.